We will begin our presentation today. Welcome, everyone. My name is Kate Kennedy. I'm with the High Tech Center, and today's session is AI in Action. It's a crossover series between the AI in Action series and the High Tech Center's Building Tomorrow's Health Center, Health IT and Data Systems Today series. We're talking about getting ahead of the hype, proactive strategies for managing AI in health centers. I'm joined today by my colleague Sophie from CCI. Sophie, can you tell us a little bit about AI in action?
I'm happy to, and I'm really happy that we're able to do this crossover because we have been convening groups on a monthly basis now for a couple of months, or several months, and we will continue to do so. So you already have an audience through high tech. We already have an audience through AI in action, and here we have an opportunity to really access resources and learn from both initiatives. So this is an initiative that is really about highlighting the practical applications of AI in the safety net. So during these monthly webinars, it is direct experiences with challenges, practical lessons learned, and the impact that we start to see from AI adoption in the safety net. And Center for Care Innovations is a nonprofit based out of Oakland, but we don't do this on our own. It's in close partnership with Health AI Partnership based out of Duke University, but also co-owned by Alliance Chicago and the South Carolina Health Center Controlled Network. And any health center controlled network or primary care association can join as a partner. It doesn't cost anything. You just become a partner and you bring it to your members and partners. And the only commitment is let us know if you see an experience that you think others should learn from. And that's it. So reach out to us. Wes will put in the chat where you can access the earlier sessions that we've had. It's incredible resources that we already start to see and experiences to learn from. You will also, towards the end, get a registration link for the future ones. We already queued up an incredible speaker for May. So back to you, Kate.
Great, thank you, Sophie. And I'll tell you all a little about the High Tech Center. We are a national technical assistance partner through the Bureau of Primary Healthcare. We are the Health Information Technology Evaluation and Quality Center. And our goal is to equip health centers, PCAs, and HCCNs with resources and guidance around health IT. We have a national website where we have a lot of different resources housed, and we also do peer learning experiences, remote trainings, and on-demand technical assistance. So for today's session, we are going to have a great panel for you to talk a little bit about this balancing act that we all have been navigating, looking at AI, comparing the hype to the risk. So where do we land as organizations in this new environment as we're navigating AI? And it is moving very fast. So you're thinking through some of these pros and cons, these risks and benefits as quickly as you can to make sure that you're staying on top of this new technology. So we're thinking about things like how can we develop AI governance policies that can adapt as quickly as this tech is evolving? What are the financial and non-monetary returns on AI investment, and what are the costs? Can AI help us truly improve care efficiency rather than just being one more task for staff to be trained on? And how do we leverage staff enthusiasm for AI while respecting the boundaries of those who are a little bit more hesitant? So there's some really in detail nuances that we're going to get into in today's discussion. I really like this visual because it really does get at this idea of a balancing act and the risks and opportunities here. So AI does have the possibility to really increase efficiency, reduce burnout, and improve care through things like digital scribes, automatic billing and coding, information synthesis, and diagnostics and forecasting. But it has some concerns. There are some potential cons that people might be worried about job loss, just higher stress related to AI use, and some imbalances in how it's implemented across organizations and with populations. There's a risk of de-skilling and over-reliance on AI tools. It could change the cognitive demands, not just of healthcare providers, but of other staff as well. There are concerns about fairness, and we hope that it improves the relationship between patients and providers, but there is a risk that it could exacerbate some of that distance between them. So how do we make sure that that doesn't happen? And we have our great panelists coming to help us navigate this today. So I will let them introduce themselves, but today we have Andrew Hamilton, Michelle Oden, and Teresa Covarrubias Gonzalez with us today to talk about this topic. So, Michelle, I'll turn it over to you to introduce yourself.
Hi, my name's Michelle Oden. I'm a nurse informaticist at the Community University Healthcare Center. My title is EHR Support Analyst, and we call our clinic Kook, so you can call us Kook too. We're in the Phillips neighborhood of Minneapolis, and we are an FQHC, or FQHCC, excuse me. We're just one site. And we're just one of a handful of community healthcare centers nationwide that also have a co-applicant status with the university. In addition to that, we're one of just a handful with a land grant. So what that means is that we're a public institution with a mission to serve the state and the people of Minnesota. In terms of patient volume, we have about, this is all from last year, around 20,000 unique patients through around 50,000 annual visits. We have a lot of learners and students. So we have a 145 FTE and we have about 185 students come through. So we have more students and learners come through than we have staff. Um, and I'd say one of the most unique things about Kook is our language diversity. Last year, we recorded 57 languages spoken at Kook, top three being English, Spanish, and Somali. So that's just a little bit about me and Kook.
Thanks, Michelle.
Mhm.
All right, Teresa.
Hi, everyone. My name is Teresa Corvez Gonzalez. I'm an admin fellow at Beacon Health System. We are a locally owned, non-for-profit health system serving patients in northern Indiana and now southwest Michigan, too. Data from last year, we're around 11 hospitals and more than 200 care sites, and we serve around more than 4,000 patients every day. We have a diverse urban and rural patient population, and I'm very excited to be here.
Wonderful. Thank you, Teresa. Andrew.
Hello, everybody. I'm Andrew Hamilton, the CIO at Alliance Chicago. We are a health center controlled network that's been in existence since 1997, initially serving health centers in the Chicagoland region. And today, now we touch about 81 health centers across 18 states, serving collectively about 4 million individuals. And it's really exciting to be here today. This is a topic that's very close and near and dear to my heart. And definitely my career has been very focused at the intersection of technology and healthcare delivery, with most of that experience now being in community settings across the US. So it's exciting to be here. Thanks so much.
Wonderful. Well, don't go too far, Andrew, because that first question is coming right to you. So we will get into our panel discussion. And our first kind of section of questions will be around building or adapting an AI governance strategy. So, Andrew, our first question coming to you is what is different about governance for AI compared to governance for other data and information systems?
Yeah, this is a great question. So, I think basic principles around data governance are really highlighted in AI because, of course, we have this deep dependency on the data as it relates to AI. So all of the discipline and structure we put to our work in data governance is related to AI for sure. But what's unique about it is a couple of things. One, as we know, AI works typically in a non-deterministic model, which means that we're not applying strictly deterministic logic to our interpretation of the data, which makes that use of AI challenging, with a second principle around transparency and explainability, which is where I think governance differs, because we really need to think about how we educate our users around how the AI is functioning and leading to or developing a result or an output that we're using. That relates then to lifecycle management within the AI data governance framework. We really need to think about continuous management of the infrastructure and the data, and monitoring for bias and hallucinations and drift. And these are concepts around how we measure the accuracy and applicability of AI. And in most of our data governance work to date, we've had more of a one-time data validation or periodic data validation and accuracy review, where in AI, it has to be much more continuous. And that's a very different principle when it comes to governance. Clearly, there are ethical and societal impacts to AI that are far reaching beyond what we might have comprehended in just traditional data governance. So when you think about AI governance, you have to be thinking about that. And we also then need to be related to that is anticipating how there's new risks that are being introduced into the delivery system or the use of AI that could be, again, for incorrect outputs or hallucinations, but also adversarial attacks on our data could not only corrupt the underlying data source, which is problematic, and we know cybersecurity is a big concern, but imagine now that that corruption can find its way all the way through into recommendations that are being developed through AI, so that that opportunity for risk is greater. Misuse and harm potentially becomes very challenging. And then finally, thinking about sort of over reliance and automation. So when we build systems that are automated, how much of the human in the loop do we need to think about to be checking the AI, which is that last governance principle, which is, where and how do we introduce human interaction with the AI? How are they in the loop relative to interpretation? And so those are some key things to consider when you think about AI governance versus data governance. Clearly very closely related, but yet at the same time, you can see potentially a little bit more broader and challenging to manage from a governance perspective.
Thanks, Andrew. That's all fascinating. We have some questions in the chat in terms of some of the terms that you were using. These are kind of new terms that we're not used to talking about as fluently as some of the other governance and data and technology terms that are more ingrained in our vocabulary. So if you have a second, you want to drop anything in the chat, we will get to questions at the end as well. We have a lot of questions for our panelists though, so we're going to keep going for now. And the next question is coming to Michelle, kind of building off of what Andrew was saying. Where do we have examples of this, or how can we assess the governance needs and strategies related to AI tools as we think about how they relate to existing systems or our experience with other systems like this in healthcare?
Yeah, and so our AI governance fits in with our clinical decision support process. So it's part of an existing process, which is really important for us with limited resources and people, frankly. So our AI specifically, our governance around AI specifically, we use a risk assessment tool that's based on the CHI risk categories. So we look at data transparency, human oversight, and potential harm. And so it's a really fast tool and adaptable, and it allows us to pull in subject matter experts from other departments because, I'm not like a rev cycle person, for example, when needed. And I mean, basically, we can't audit everything perfectly. And so this helps us with triaging. It helps us identify red flag tools where we can put our resources towards.
Great. Thanks, Michelle. And some of those words are more familiar, that we're used to assessing risk of tools. It's just you have to be quicker, you have to be more adaptable to keep up with the pace of this technology. So that's a great reflection.
And I will say that this was a pivot because originally our governance was sort of focused around pilots and things like that, and it's just coming too fast. We just don't have that kind of we have to be more nimble. So we switched to the risk assessment tool.
Yeah.
And it seems to be working well. Yeah.
Great. Thanks, Michelle. All right, coming to you, Teresa. Again, building off of these great reflections. So, with this in mind, who should be at the table for some of these AI governance decisions? Maybe similar to how it has been in the past, or different, given this new world that we're in.
Yeah, absolutely. And just kind of building off of what Andrew and Michelle mentioned, if you look at it, they mentioned two different approaches, right? AI governance being built from the data governance they already had in their teams, and also the clinical decision governance. So what this means is that AI is not just a technology itself, and the more multidisciplinary approach we can give this, the better outcomes we will obtain, right? So again, AI is not just a technology. Think about change management. Think about the cultural shifts for your teams. Think about the operational changes in your workflows. So it really impacts all of us in different approaches. So I think a great governance is built of course, our folks with the clinical perspective, operations, risk management, IT, finance, patient experience. Now that we think about, hey, patients know that AI is being used. How can we make them part of the conversation too, right? HR and definitely cybersecurity. So it's teams look different. You might not have all these teams in-house already. So depending on your needs, I guess is where you would start pulling in people. But that multidisciplinary approach will definitely help you have a holistic view of what matters when taking decisions in implementing or creating AI tools.
Great. Thanks, Teresa, and thanks all. Our last question is for the whole group. Chime in however you'd like to. And this kind of gets at the heart of the matter. We've talked about some strategies, some things to think about, and people are still feeling pretty overwhelmed by all of this. And at one of our recent sessions, someone simply asked, "Where do I start? Where do I begin with governance?" So where can you direct people either for resources, or for partners that can help them kind of navigate this? And another question that kind of comes up along the similar vein is, what do I need to do versus where is there help already, or where can I outsource some of this or get some really tangible help just developing this governance model? Any takers?
I'll go ahead
Well,
and talk about. Oh, Andy, please go ahead. Oh,
yeah, I was just going to say, some of the frameworks that were mentioned here already are, I think, good places to at least ground yourself in terms of the higher level thinking. And then I would definitely think that starting to review your data governance would be a great place to start, because it will serve as the foundation, I think, quite a bit relative to than these other principles that I mentioned around sort of where does AI differ. But I think starting with really strong data governance, understanding your processes, know who at your organization is involved, and making sure you have that kind of multidisciplinary team. And then understanding your data vulnerabilities, because those vulnerabilities are going to then be very important to know as you think about AI governance. So those are kind of two starting places I think of off.
thank you. And I would also add that what makes this time, yes, it's a lot of change and it's a lot of unknown, but it's also very exciting because, at least in my experience, I've been able to reach out to people already doing this work of putting out their frameworks on how healthcare organizations should approach AI, try the Health AI partnership. And to this date, I haven't received anyone not wanting to speak with me and kind of guide me, right? So that would be my first recommendation. Reach out. I also think it's very important to see what universities close to your healthcare organization are doing. We've been learning a lot about what Notre Dame does, and even though it's a different industry, it's kind of the same thing of how do we make sure that we use this very powerful technology in a way that serves us in the correct way, right? So it's very interesting also to learn what other industries are and how they're approaching AI. But I would definitely start with looking into the Health AI partnership. They released a great vendor disclosure framework, which basically guides you. Okay, now you're thinking about AI procurement. This is where you start. And they were a big help in us for us as we started to define our governance process. And it's a work in progress, right? Things change, technology changes. So I don't think right now to this day anyone can say I'm 100% expert in AI because things are evolving very fast. So you're not alone in this, but start with the resources already out there and connect with people doing the work. LinkedIn is a very powerful tool. I found a lot of resources there. And yeah, just reach out and check what's already out there.
Thanks, Teresa.
Yeah.
And Michelle, I know we talked a little bit about, and Teresa mentioned vendors. What has your experience been with assessing the vendors for your AI tools at your health center?
Well, I don't know how helpful my experience will be because ours we go through the U, and so we have
That's
our
right. Yeah.
we have yeah, so we have our Office of General Counsel go through it for us, and obviously not everybody has that. So that's, but what I was just going to add is that first of all, yes, HAIP is amazing, and we were part of their inaugural cohort, and they're just the best. So please, yes, if you can reach out to them. And they have a lot of resources just on their website that are extremely helpful. You don't even have to necessarily become part of the network. But what I was going to add is that I think it feels sometimes can feel like you have to have everything in place to start, and that's absolutely not the case. In fact, I would say you're never going to have everything in place. And so to just start is really important. Like I said, we've had to pivot and shift multiple times. Like this was not by any means like a straight path. We've gone every which way, and we're still having to pivot, and I'm sure we will in the future. So, to start is, I think, the most important thing. And sort of starting where you're at, like where are the pain points in your organization? Like, do you have a million AI tools that are currently on and you have no governance around? Like, or is there something more pressing that you would really like a solution for? Is like maybe another thing to think about. So anyway, just wanted to mention.
Great. Thanks, Michelle. That's so true. Yeah, lots of pivoting, nimbleness, being ready to figure it out together. But there are a lot of resources out there. I know we also in discussions have heard about certain softwares that can help you develop your governance frameworks and models. So there are things out there also for health centers. Lean on your HCCNs. They're also thinking through this a lot and really thinking about it actively. So definitely you have some in-house in-state experts there to help you with this. Okay, we're going to turn a little bit to return on investment next is our next set of questions here. And coming back to you, Andrew, one of the concerns is that if an AI tool is adopted, or even if it's a native feature in your EHR, and it's rolled out to staff and integrated into the workflows, what happens when the EHR decides, oh, we're going to charge you for that now? It was a free feature, but now we're going to charge you for it. So how should health centers be thinking about the reasonability of costs and how to kind of keep an eye on this and even advocate with their EHR systems to have a voice in how this is affecting them financially?
Yeah, this is such a great question. I think maybe just to start that there's maybe a similar framework for how we evaluate total cost of ownership or do cost benefit analysis of tech in general. All of that applies to AI. It is tech, and you're going to need to think about the cost, even if it's being added on from your EHR vendor. But specifically, what's interesting about AI cost benefit analysis to me is that obviously it's much more complex and we have to think beyond the software sort of vendor assessed costs. So there are other considerations such as implementation and training expenses. So what does it take not only to get people comfortable with use of the AI, but I see these questions in the chat, like how do we monitor how people are using AI to make sure it's effective, but also that it is delivering accuracy and relevancy to our population. And so there is a cost of monitoring in the use of AI that's maybe different than some of the traditional tech we've been comfortable with in so far. The second thing is the infrastructure and support costs. So we talked a lot about data in the last session, and Obviously, the quality of the AI and its accuracy and its dependability is very tied to the data itself. And so the cost for data hygiene and data management is a true cost that really is leading to the expense of AI, and I think is sometimes missed in some of the AI return on investment models. We assume we already know the cost to maintain our data, but we're not maintaining our data maybe in the same way we need to from an AI perspective. So there's probably additional infrastructure, people, process, and technology costs to make sure the data is consistent and accurate. And then there's monitoring costs. Like if you think about your quality improvement program and how you monitor your whole system from a process and outcomes measure to understand its effectiveness, that's the model I think about when I think about monitoring AI. In fact, our quality professionals in our organizations might be the one of the best advocates or capabilities that you have to lean on to help you monitor AI, because they have insights into operational and clinical outcomes that you can be monitoring as you deploy AI to make sure that the AI is not introducing unintentionally a potential consequence to either lowering efficiency of your workflow or hopefully not, or potentially compromising the outcome. And so the quality monitoring we do from a QI and overall quality improvement perspective might be a really good place to start when you think about how do I monitor AI. It's more complex than that, but it's something to think about. And so for those reasons, I think the cost benefit analysis is more complicated for AI. But I think if we use some of these frameworks that we've been talking about, we can really put more intention around our monitoring of the costs so that we can understand, are we getting the benefits we hoped for? And then, communicating that back to vendors, or of course, if you're in a contract for some AI solution that's not working out the way you had hoped, you could have a process to remediate or terminate that agreement.
Yeah, thank you so much, Andrew. That's very valuable insight. And Teresa, as we're looking kind of to figure out return on investment, how can some of, like Andrew said, some of the ways that we've done this before, how can they work for AI, and what might be some of the hidden costs or even the non-monetary benefits that might not be as obvious as what we're used to thinking of with AI, like increased efficiency?
Yeah, this is a great question. And I want to share that this question is being asked in all industries as well, manufacturing too. So it's not something just for healthcare. And I think it's because AI kind of challenges us to redefine what return of investment means. So of course you have different AI use cases. So that return that you get depends on the use case. But again, it's not just that there's an economical return or measurable path. If you are setting kind of like an enterprise AI setup for your call center, for your back office, then you can kind of think about a traditional return on investment. Like if you would buy a machine to do certain things and you're trying to, make your cost analysis, then you have a more traditional ROI, right? But if you think about tools like ChatGPT, Copilot, Claude, and maybe even having an enterprise level kind of access, you should be thinking of return on investment on a different way. You have productivity, employee engagement, creativity, learning. And Dr. Brente from Notre Dame really explains this in a way that just kind of blew my mind, being why I'd like to share a quick graph with you all.
Go for it.
Perfect. So yes, we have the traditional way of thinking about return on investment, right? What's that economic return I'm getting on my investment? But with AI's coming, we need to think about it as a layered return. We have the intangibles. This is like the organizational culture, the brand, being positioned as an innovative organization. Those things that you can't really see, but it's kind of part of your culture and brand. So think about like the soft skills or values that your organization now built, right? You have a reputation as an innovative organization, or you're helping shift the employee mindset into AI. Oh, sorry, I think I didn't. There we go. That's kind of what you would think about in the intangibles. And then he also explained the capabilities you gain with AI implementation or AI investment, right? Here in AI capabilities, we should think about like that knowledge and infrastructure that you gain. First, as Andy was mentioning, you invested in a new AI tool, but now you found out that one of your processes wasn't working the way you thought it was, and now you need to clean up some data. Well, if you look at it in a certain way, that's also having a return, right? Because you're able to get more ownership and standardization of how you operate. Um, and then you're building these pipelines, you're training your teams, and you're building this institutional knowledge. Aside from that knowledge that you gain, you're also getting digital literacy. And that's a big thing, which jumps into adaptability. What is the cost? Right now, we're seeing how do we work with AI? How do I make it work? Where do I start learning? So think about that adaptability and digital literacy. Right now, by investing in certain AI tools, you are now prepared to jump into the next big thing that comes up without the fear of being left behind. So when he was explaining this in a group full of folks from manufacturing and us in healthcare, it was very, kind of like, that is true. There are things, there are layers that we don't see that we're just, if we try to just tie the economic component to it, well, we don't give it the enough value. So for me, it's that adaptability that your team gains and that you are prepared to jump into the next big tech wave as it rolls out.
Great. Thank you so much for sharing that. It's kind of bending my mind a little bit to think about all the different layers and the ways that this is coming at us, but also could be leveraged that we just aren't thinking through fully. So that's fantastic. Thank you, Teresa. And Michelle, coming to you from the perspective of a smaller health center, what have been some of the challenges in measuring this return on investment, either direct economic return on investment or others?
Yeah. So I think our experience mirrors a lot of what Andrew and Teresa have said. So most AI tools don't come in with a built-in measure for ROI. So you sort of have to piecemeal a measurement yourself and choose metrics you hope might be affected, like retention and turnover, for example. So the tools are coming in faster than the measurement pieces, and there aren't these like sort of legacy measurements that will move with certain tools, where it's being built. So as everybody has said, measurement may not be traditional ROI. So for us specifically, like with our ambient scribe, for example, we're not asking people to see more patients in a day, and we're not asking them to take extra clinics. It's like, what's the point of this technology if everybody's just going to stay as harried as they already are, right? So what we're finding with this is like, in the end, yes, we value the data, and I think in later questions we can get into the data because there is data, but we're putting a lot of value on user experience and whether users say that it's helping them in their practice. And that is where we're sort of holding our value right now.
Great. Fascinating. Yes. All right. Now, coming back to all of you, curious thoughts on the cost of not adopting AI, or even if you want to just take a beat, wait and see what happens. Are you missing out? Are you really missing out, or is it not as urgent as it feels sometimes?
I would say here really depends on the use case. You need to know your system, you need to know your team's needs, you need to know your patient's needs, because there's no linear AI journey for everyone, I would say. So you might want to start with the productivity of your teams and helping them take off administrative burden they have to complete every day, or you want to start predictive analysis to kind of get a better scope of your ER in patient visits, right? For example. So I guess I would say that there should be kind of like a strategy of thinking, where do we need the technology the most? And then sometimes it's not all AI. Today, someone from one of our hospitals reached out and said, I have this problem. I run too many reports, but I don't have the appropriate data, etc. So we kind of sat together, went over the problem she was trying to solve, and at the end, there wasn't a need for AI. It was just kind of using Excel in a different way, right? So that's kind of what I would recommend. Start by knowing the needs of your teams and the goals you guys have, and then start from there. And AI is a very powerful tool. I do encourage to learn as much as you can, again, for this thought around digital literacy, but don't be rushed into implementing a tool that you haven't validated you really need yet.
Mm-hmm. Great. Thank you.
Yeah, I agree with that absolutely. Um, and I would say, with HAIP, for example, we ended up, because of issues getting the tool that we wanted in place, like we ended up focusing on our governance first. So we actually had some kind of governance structure in place even before we implemented our first AI tool, and that was really helpful.
Mm-hmm.
But in addition, I um I kind of like lost my I think so. I think the thing is to be sort of cautiously optimistic. I'm sorry, I lost my train of thought, but it came back. Our providers are I mean, I'm being very broad here, not everybody, but we have a lot of really skeptical providers. We have a lot of patients who are in a really vulnerable situation. So we have practitioners and our admin staff, myself, that think about the protection of the patient first. And we also, like I said, have a million languages that are spoken, and we have interpreters, and we have students in the room. Sometimes there's like 5 people in the room. We have care coordinators in the room. It's like, so for example, with our ambient scribe, all of these things came up as concerns, like patient disclosure, patient consent. All people were very concerned with good reason, right? The privacy of that patient data, with the like environmental things that were going on in Minneapolis at the time, things like that. And it was, I would say, a runaway success. So
Mm.
I think it's not always going to be like there are going to be tools that are helpful, tools that aren't, but I think it's okay to um, be a person who's cautiously optimistic and to address all those concerns too. I mean, you have to address them. But I think having, sort of the thought that, yeah, there could be a solution, but like Teresa said, it may not always be AI. It doesn't have to always be AI, right?
Mm-hmm.
But again, to go back to my first point, having something in place, like having some base governance in place, I think is really helpful for when a solution does come up that you want to implement. So.
Yeah. Yeah, having that North Star. And we talked to,
Mhm.
especially with safety net healthcare organizations like health centers or safety net hospitals, really, how do you integrate your mission into your governance so that you have that to fall back on when it does feel overwhelming, when you feel like you gotta push, push, push? Remembering your patients, remembering your purpose and your mission is really critical. So I'm actually going to skip us down. Candace is inspiring me here in this chat. We do have some questions. We want to hear from the panelists about centering staff well-being in AI adoption decisions. So Michelle, you started to get at this, so I think it's a perfect segue. Thinking about the human side of this. So I'm going to come to you first again, Andrew. A lot of the focus has been on provider perceptions of AI because they go first to thinking about the clinical uses and some of the ethical dilemmas that creates. But what are you seeing in other roles in terms of the acceptance or the hesitancy around AI use?
Yeah, I mean, that's such a great question. So I think about maybe just from a category of participants in AI governance. So I'll simplify it maybe. So, and these are in no particular order, but on the
Mhm.
IT and sort of data teams, I think challenges with integration, managing the security threats or possibilities, monitoring model performance. Like, this isn't to say that these folks are resistant, it's just their sort of responsibilities in an idealized framework for AI governance. That's the things they're grappling with. And so maybe hearing those concerns not as not being supportive of wanting to adopt AI, but they're putting like their real world life out there. On the operations and administrative side, we talked a lot about that ROI. There's enormous pressure, especially now, and certainly more to come with some of the headwinds around policy changes and Medicaid, to
Mhm.
be very parsimonious in our selection and use of AI because of the cost that it will entail. So I was going to say in the last question, like, where do you find yourselves in that sort of spectrum of readiness for AI adoption or openness to it? Really, it's that sweet spot where you're going to find where you have the biggest need for efficiency and improved outcomes against the cost that it might, if you don't adopt AI, there might be some real competitive advantages to consider. So our operators and our administrative folks are thinking a lot about that. Related would be, I would put the group of staff in kind of the compliance and legal space. There are a lot of margins to manage here when it comes to risk. And so when I think about our compliance offices and QI folks, I think a lot about how do we grapple with the assurance and monitoring of AI. And one of the things that hasn't come up yet explicitly that I want to point out here is we all know that there's a current federal administration approach that's deregulatory. That is the posture of the Office of the National Coordinator for Health IT. That's certainly coming from HHS as a whole, this sense of deregulation, which there's some advantages to a market like that we could talk about, but a challenge in this space is without the benefit of more federal regulatory guardrails, that pushes down the responsibility locally. And the risk of that then is real for our compliance folks. So I think that's a group. And then, we've talked about our care providers, but I'll just say here, I mean, I think anytime we've had innovation and new tech in healthcare, it's often comes up that our clinicians, are feeling a little unsure, uneasy. And part of it's because they didn't have the benefit of using AI in their training if they're more veteran employees in our health systems. And they haven't maybe had as much opportunity to learn about the benefits or risks of AI because they're so busy with our primary role as clinicians. And so thinking about our workforce and what it means to keep them up to date, feeling safe, feeling like they're positively contributing is a big challenge. And so I think those are some of the things we hear when we kind of go out in the field about sort of readiness and thinking about hesitancy around adoption.
Yeah. Wow. So many. I feel for the compliance folks right now. It is a tough time to be in compliance for sure. But that's great insight. And Michelle, you kind of touched on this a little bit earlier in terms of how your staff is receiving this and thinking about it. How are you surveying staff to get a sense of their thoughts on this, or how are you getting that feedback from your staff about AI?
Yeah, we're doing a lot of surveying. I almost feel bad how much, not really, but like a little bit. Like, here's another one. We're working with the School of Public Health to perform at the U to perform pre and post pilot interviews. We have surveys, and we're really trying our best to capture user experience. So they'll do personal training with me. If, for example, with our ambient scribe pilot, they had chats where they could discuss the tool and give each other tips and tricks and complain or like whatever. There wasn't actually a lot of complaining. And then we have a lot of sort of tracking to see which users are most prolific and which ones aren't using it. And then we try to connect with those people and say, why aren't you using it? You don't have to use it, but like what's going on? Like what isn't working? Things like that. And then, we're trying our best. Again, we're a small clinic, so it's more possible, but there's so much information that gets shared just provider to provider. So, I'm part of the chats too, so I can see that, but I try my best to kind of like, and I mean, we're in rooms with a whole bunch of providers all the time, like we work in really close quarters. So, I do my best to keep my ear to the ground and also hear about like what their experiences are. They share so much with each other. So yeah.
Yeah, that's great. And I love that you're involving the School of Public Health. There's so much information just in observing how this is unfolding
Mhm.
in this
Mhm.
industry, that
And
can
I
be
just wanted
informative.
to,
Yeah.
yeah, I just wanted to mention one thing with what Andrew was saying too. It just sort of an important point that I just want to make, which is because we have so many learners, they're coming to us with the expectation that AI is going to be part of their practice. So part
Mhm.
of us n not falling behind in that is to learn how to integrate it into our practice. And of course, there's so many conversations about is it best for them to learn how to write a note, like, knowing how to do that is important, just like foundational stuff like that.
Mhm.
I'm not going to get into all that, but we have to be prepared for that is my point too. So there's also this piece of the next generation of providers that we have to keep in mind. I just wanted to mention that.
Yeah, great. And on that note, coming to you, Teresa, you mentioned change management earlier. And for folks who have been in healthcare for any period of time, the only thing constant is change, and you're always trying to learn the next tool or get trained on the next technology. So what has been your approach at your organization to managing this change, and without burning people out?
Yeah, absolutely. So in August of last year, we started an AI needs assessment. So we kind of ran it through the entire system to get people's feelings and thoughts and ideas and perspective on AI. So there was a lot of divided feedback. You have people who have a more experienced knowledge now, but then there was also people who said in their comments, I'm afraid, I've never used this, I don't know what is this, right? So then we kind of decided that we should start with basics and then at least try to have a system level understanding of what AI is. So we ran a series of workshops. We had 3 workshops: AI 101, intro to AI, definitions, examples, use cases. Then we had an AI do's and don'ts, where we talked about kind of like the ethical aspect of the AI and responsible usage. And then we had everyday AI with Copilot. We used the Microsoft suite, so leveraging the Copilot access we have, right? Like prompt engineering, sharing use cases. We even created some no code agents. So that has been very helpful. And then we also launched our AI Explorer pathway, which is, I think, no more than 60 minutes. And we were very intentional about having a holistic approach. We believe administrators should know how AI tools can impact the clinical care, but also vice versa. So it's kind of we created these videos ourselves, and of course we even included a short module on how to procure AI tools, and this was based again on the AI vendor disclosure framework by HAIP, right? So I also think that as new tools roll out, it will be the training that different teams get is depending on who's going to use those tools. I believe that there should be definitely kind of an onboarding and training if you launch a new tool, and maybe just some system awareness. Um, there's no need for our nurses and doctors or other providers to become data engineers, but I think we all should know kind of at least the building blocks of AI tools and their limitations. So that's kind of how we've been leveraging it. And to avoid that change fatigue, kind of thinking about starting with our work and not the technology itself. Right? What are our bottlenecks? What in our day-to-day causes so much slowness? What tasks are repetitive or manual? And then basically what problem we're trying to solve. And then we can talk about the AI, right? So when you ask the teams what takes time from your teams or what takes time away from your patients, there's a more kind of like, okay, maybe I do want to be part of this because it's going to help me in the long run, right? So at least that's how we're currently approaching it, as AI being there to augment and support what we do. So just having the teams ask themselves, can AI automate this? Can AI summarize or organize this? Just looping in your teams when talking about and looking into use cases for AI. I think that concept of how can AI work for me will build the trust and support you need from your teams.
Yeah, that trust is critical. That's great. And I know, Sophie, you've been busy in the chat. We've had a lot of questions coming in, really interesting thoughts. So we do want to take some time here to open it up to some questions. Although I think Andrew's been jumping in too, so we've been answering questions left and right. But Sophie, are there any themes coming up for you that you're seeing in the chat that you want to raise to the panelists, or questions that we can take on and try to tackle as a group?
I just want to say thank you for all the participants. This chat is to be saved. Amazing. One that I want to point out, someone was asking about all these frameworks that are being mentioned. There is an answer. Wes has put a link where most of these frameworks are saved in a folder. So go and grab that link in the chat. But one question that has come up and are hinted to in different ways is, yes, governance and upfront assessment, but how do you manage the ongoing monitoring in resource constrained settings? So between the 3 panelists, how have you managed that? We know that's a major challenge with with the algorithms changing their performance over time and so forth?
Start by maybe I guess it's use case and specific tech dependent. Where is the AI being used? So that's maybe obvious, but it makes it really hard to make an umbrella answer. So the first thing is, as you think about the AI use case and the tool that you're adopting with intention, where are the vulnerabilities that you want to be monitoring that solution for? So if it's a AI solution to assist in prior authorization, which sounds fantastic and maybe low risk, well, yes, that could be the case, but what happens if it messes up and the prior auth is not successful or doesn't happen at all? So I mean, I'm being dramatic here, but so in that use case, we would think about what is the intended use of the technology, what are our expected outcomes, and where are we wanting to monitor for its effectiveness? And in that case, what are the process measures around ensuring it's working effectively? Another example might be this AI scribe. I mean, I'm sure Michelle can offer more insights into that. But for each solution that you're considering, there should be a conversation up front around intention for monitoring. And then I love what Teresa shared around like thinking about it in a layered approach like you do on an ROI. So what are the kind of human impacts of the use? What are the system level impacts that might be a little bit more intangible that you want to make sure you're monitoring for? And then we ended with compliance. There are going to be some use cases where especially compliance is really, really heavily important. So patient consent I saw came up in the chat. So you've got to monitor for that. You've got to build a plan to understand, are we appropriately consenting patients for this particular tech solution that we're rolling out? So with each of those, I think you can set up front what those measures are. And then last, I'll just say, as I mentioned before, I think lean on your quality improvement or QI staff. They are so adept at understanding both individual and system level monitors that are important for their work to date. And I think they can bring you a lot of insights into your system level capabilities to really get at those measures that you're monitoring for that particular solution. So those are just some thoughts I have up front.
Thanks, Andrew. Michelle, Teresa, any thoughts?
Just echoing what Andrew mentioned, right? Start with what are your goals, what are your needs? And there was some comments about like there's a push of maybe pushing aside the human in the loop component. That might, in my opinion, that might apply for other industries, but we are in a people industry, and what matters the most is that human touch, that human contact, that care we give for our patients. So just kind of echoing, don't forget about your mission, about the mission your system lives for, and then the technology can come in secondhand.
Mm-hmm.
That's what I would add.
Yeah.
I don't have much to add other than like, I mean, this is a conversation that we're having too. So, I mean, how do you like, you know, what kind of monitoring do you do of providers' notes or things like this? Like, how do you actually monitor this stuff? It's a conversation that we're having and we're going to have to continue to have. So I don't have an answer.
Yeah, that's
So I was
okay.
listening too. I was like, oh.
Yeah. We're all still learning for sure, for sure. Great. And I think well, Sophie, any other major questions you want to highlight before we wrap up today?
No, I think we can move on.
Okay, fantastic. Well, we just have a few more things to share with you all. I do want to just thank our panelists so much. This has been a fantastic conversation, and really just couldn't have picked a better group of folks to come together and think through some of this stuff. Also to note, we did not coordinate their outfits. That was purely coincidental. So stripes are representing today, and it just worked perfectly. So I'm going to share a couple more slides with you all. We do want to share some upcoming events. As we mentioned, this is part of the AI in Action. There's more of those to come. And we also have a skill builder series that we're doing with the High Tech Center right now. If you haven't seen it or signed up, we do encourage you to do that. Our next session will be on April 29th about documentation integrity in health IT. And then for this group in particular, and this is limited to health centers only, but we will have a fantastic community of practice about AI and during the month of May. Those will be weekly sessions with a smaller group, really diving in and getting some hands-on discussion around AI, and rounding that out with a session on addressing social drivers of health in your EHR workflows. You can earn a badge as part of that series that we're doing. And then Sophie, do you want to talk a little bit about your next AI in Action session?
Yes, Wes can put it in the chat again. You can just click on the link and register so it's on your calendars. May 13th. Chris Kelsch, also thank you for joining us here today. Chris, I saw that you joined. He is the CEO of Winters Healthcare and does incredible work in some of the hardest parts, the rural areas where it's very hard to retain staff. And he has an approach around really looking at what does this mean to the providers and the patients. So you will have an opportunity to really learn from the journey he's on. And for all of these AI in Action sessions, there's no one who's an expert because we're all learning together. So also let us know if you have an experience that you think should be highlighted from practical adoption in the safety net. And if you're an HCCN or a PCA and want to be a partner, also just reach out to us. And then back to you, Kate.
Wonderful. Thank you, Sophie. And thanks again, everyone. Please, please, please take a moment to complete the evaluation for today's session. We do all look at those very closely. And there were actually some great ideas in the chat for what we could do a whole nother webinar on. There's lots of different elements to this that we can cover. So please share your thoughts and your feedback with us. And we hope to see you at a future session. And thank you all so much for your time today. We appreciate it.
Thank you for having us.